When you think about improving public health, the role of the economy might not be the first thing that comes to mind, but inclusive and sustainable growth central to the shared public health priorities. Scotland, alongside other countries, is increasingly moving from GDP to well-being as the benchmark for economic growth.
What's exciting is that we've got the National Performance Framework, which has got some great language in it. So we've got that top level, we've got political leadership in places, putting the wellbeing economy at the forefront. The next, step forward in that process has to be really opening up the black box of policy making and saying, okay, we need to change how we incentivise frontline staff, we need to change how we procure things, we need to change who is at the table when we're making these decisions around economic development policy.
Inclusive growth is already on the agenda for communities benefiting from growth deals, supported by the UK and Scottish governments.
But an evidence-based approach, looking at what the evidence is telling you, what's not working in your area, why is it not working, and where can you bring an intervention to tackle that. And it's not just about what you can do as an economic development service, it's about that whole systems approach and bringing other people with you to help. It's a partnership approach.
The move towards inclusive growth comes at a time of democratic change, with councils required to allocate at least 1% of their budgets to participatory budgeting by the end of 2021. Designed to help reduce inequalities, PB gives communities a direct say on how resources are used.
For me, talking about inclusive growth is an opportunity to think about how we democratize the economy. How do we think about some of the creative models that are already out there, cooperatives, social enterprise, the social economy, and how do we bring that into the mainstream?
To realise success, partners will need to work more closely together. The national drive to make a positive change is promoting a whole system approach to deliver the public health priorities.
Our whole systems approach is really designed to support partnerships to deepen their collective understanding of the issues that matter most to communities and to strengthen the delivery of those collective actions needed to address these. Importantly, it puts learning at the heart of how we work together. We've developed a set of 9 characteristics for this way of working to support those who are interested in adopting a whole system approach. And these are intended as a tool to support discussion and reflection across a broad range of partners.
And so the shift to put well-being at the heart of our economy is already underway. Working together to a common aim, the ambitions to empower communities and deliver inclusive and sustainable growth.